Tick-borne Lyme disease is a major health concern in this region. Recently, Michael Bensche from Braman Termite and Pest Elimination and Dr. Jose Martagon-Villamil from Bay State Medical Center came in to talk about both prevention and treatment and to outline the dimension of the Lyme disease problem here.
Lyme disease has now the infamous distinction of being the single most common tick-borne illness in this country. There's many others, but Lyme disease is the number one. And as you said, it is tick-borne. You don't get Lyme disease from somebody coughing on you. You don't get Lyme disease from somebody handshaking you. It's always tick-borne.
And Mr. Bensche, let me ask you, I don't tend to think of ticks as something you talk to the professional about. I mean, I know there are things individually can be done, but they tend to be outside. You don't think of spraying, but there are things you can do, correct?
Absolutely. There are insecticides nowadays, and we lean toward green products, what are referred to as FIFRA 25B exempt insecticides that are able to be used. They actually do not even have an EPA registration number. They're considered so safe they can even be used around wetlands. So they're basically botanically based insecticides. They have a very good knockdown of ticks, or mosquitoes for that matter, but they're very short-lived. So you'd have to do it more often, but they are effective.
Well, let me ask you about that. I've heard what's called a contact kill, this FIFRA 25B. So you put it down, and any of the creatures that you're trying to get, the ticks, mosquitoes that come into contact with it, are gone. But a couple of days, couple of weeks later, how soon is that pretty much gone? It's a botanical element, right?
Yes. But they're somewhat repellent, though. So there's a repellency effect that does last a little while. And as you stated, if it contacts them, usually at the time you're spraying, it's not so much that 2 hours later or the next day they're going to come up to it, contact it, and then die. It's that you sprayed it on them now, and they're going to die, and then others will be repelled because of basically the odor, which tends to be kind of a strong citrus type of an odor.
Oh, Doctor, let me come back to you now. The event that we don't go out and get the FIFRA 25B,
yes.
Don't do our due diligence, we find a tick on ourselves, on our clothes. First thing we ought to do, I guess, is check ourselves after we've been outside,
Exactly.
Correct?
If you've been out gardening, cutting brush, on a hike, etc., we absolutely recommend a thorough tick check. I cannot tell you the number of times I have discovered tick checks in my child, little ticks in my child. We encourage at the time of your hike, your gardening, etc., to wear either boots or high socks, tuck in your pants to the socks, that kind of common sense protective behaviors. Ticks are going to come from below, the brush, the tall grasses, the vegetation, the leaves. So that physical protection already is helping. Tick check after your hike or your gardening. Find, if you can, a tick as early as possible. The transmission of Lyme disease is time dependent. We know that a tick has to be attached and feeding and engorging for at least 36 hours to transmit Lyme. That is not true for other illnesses. Other illnesses like babesia, ehrlichiosis, and anaplasmosis can be transmitted with much shorter feeding times. But Lyme at least needs 36 hours plus to transmit. So the earlier you pick up the tick, the better. And once you find the tick, we recommend a little pair of thin tweezers so that you can get to the bottom of where the head parts are attached to the skin, and in one strong, swift motion, take it out. And this is another little pet thing of mine. Bring us the tick. When you bring the tick to the doctor, we have the ability to look at it with a magnifying glass, and we can tell if it is an Ixodes tick, a blackleg tick, the deer tick that transmits Lyme, or other ticks that are out there, dog ticks, soft ticks, etc. Because if it is not the blackleg tick, the deer tick, it does not transmit Lyme.
And that's particular, isn't it? The black-legged, or what we call the deer tick, is the only one that if it gets in, stays on us a while, that's the one that gives us the dangerous potential for Lyme disease, right, sir?
That's true, and of course one of the things about the black-legged tick is it's very small. And in fact, at the early stages, it's really small. In the nymphal stage, in the first instar nymph, they're rather small. So they're not that easy to see. So they actually also recommend that we wear light clothing when we're doing these activities because it's easier to see them against a darker tick against a light background.
I mean, we're really talking, tiny, tiny, aren't we, when they get on you before they do get in, get some blood, get engorged.
Correct. When they engorge, they're much larger and much more visible at that point. So we're hoping to avoid that.
Correct. I invite your viewership to simply go and Google images of the ticks. You can find very easily images of ticks with size comparisons. The little nymph is smaller than a millimeter. The adults are between 1 and 2 millimeters, so very, very tiny. As they engorge, they become bigger, easier to see, but Mike is right. I mean, especially the nymph is extremely hard to see. It could be even sitting there feeding for a day or two, and you might think it's a little speck of dust or a speck of dirt. Yeah.
It does happen that people are bitten, don't know it, and then sometime later, there's a case recently, the well-known singer and actress Avril Lavigne, who said she was terribly, terribly ill, and it took physicians a little while to realize she had Lyme disease. Correct. She's now being treated. But tell us some of the things to watch for. Maybe you don't see the tick on you, you're outside, it gets on your back, you don't see it. What happens? What should tip you off? I might have Lyme disease.
Absolutely, Jim. Well, first of all, let me say that, in fact, the not remembering the tick is actually the most common scenario. Less than 50% of people with a diagnosed, proven, 100% sure Lyme disease actually remember the tick bite. So, in fact, the most common scenario is not remembering the tick bite because they feed, they attach, and you lose them, and they may be in a place that you never saw it, like your back, buttocks, etc. So, anyway. Once the tick is attached, once the tick is feeding, you have an incubation period. What the literature tells us is that it's between 3 and 30 days. So from the time of the tick bite, between 3 and 30 days, you get the first stage of Lyme disease. Lyme disease, in that sense, is a fascinating medical paradigm. It evolves in stages. The first stage is what we call the bullseye rash, the erythema migrans. So the area where the tick bite happened starts getting red, and the redness starts increasing and forms literally like a bullseye, a rim of erythema that blanches in the center and grows gradually. That first stage can be accompanied by some generalized symptoms. You feel a little sick, a little achy, a little sore throat, muscles hurt, joints hurt, and you have the rash. But sadly, not everybody gets the rash. Again, what you find in the literature is that anywhere between 80 and 80% of people get the rash. 15 to 20% of people don't even remember a rash. And that's hard because if all you have is a little achiness, a little, headache, it may pass as a viral disease. You may think, oh, it's the common cold, when it really was Lyme disease. Hence, from spring to fall, big index of suspicion for anything like looks virally or flu-like illness could be Lyme because not everybody has the rash. And if that stage goes by undiagnosed, unnoticed, then people progress to the disseminated stage. And the bacteria goes to several places, goes to other parts of the skin, so you can get rashes in different spots in your skin, joints, so you can get swelling, especially of the knees, but sometimes other joints, nerves, so you can get what we call neuropathies, very painful nerve inflammation. You can get what we call facial palsy, like a facial droop, the face is droopy, and what we call meningitis, a nasty headache with what we call photophobia, the light hurts you and the neck is tight, etc. And it's bad. By then, the disease is disseminated.
Well, gentlemen, thank you very much, Dr. Jose Martagon-Villamil, Michael Bensche, for coming and telling us what to watch for, what to watch out for with Lyme disease and tick season. Thank you, gentlemen.
Thank you, Jim.
Thank you for having us.